Any level of alcohol consumption or illegal drugs by crew members on board has implications for the safety of the vessel, the crew, and any passengers. Even small quantities of alcohol have been shown to sufficiently impair seafarers' fitness for duty and increase the risk of accidents. As such, Regulation 8/1, Code A 8/1 and B 8/1 of the STCW Convention, as amended in June 2010. The Manila Amendments brought in new provisions on fitness for duty, alcohol limits. Alcohol use, especially binge drinking, can lead to risky sexual behaviors. What makes these behaviors risky to the individuals is they may result in sexuality transmitted disease or STDs. It increases the risk of STDs in three ways: through multiple partner, at protected sex, sex without a condom, and combining additional substances with alcohol and sexual activities. Alcohol lowers inhibitions, which means that both men and women are more likely to engage in casual sexual behaviors that they would not otherwise do if they were sober. Heavy drinkers are also more likely to have multiple partners, increasing the risk for HIV. Finally, alcohol can also impair an individual's immune system, making it harder to fight off an STD. This is why destinations for teens takes alcohol abuse disorder so seriously, because young adults and adolescents could derail their lives. The application of training and the education of seafarers and shore workers in the effects, symptoms, and result of drug and alcohol abuse. Promoting and raising the profile of prevention. Coordinate accident reports and provide risk assessment, data, and other information that may be used by the country's maritime industry to raise the profile of the subject and to promote the dangers posed by drug and alcohol abuse. Setting safety limits, prescription of a maximum blood alcohol level for watchkeepers as a minimum safety standards, and any other prohibitions on the consumption of drugs, including prescribed medications or alcohol that can impair the ability of watchkeeping. Seafarers or those on board engage in safety-sensitive operations. Provision of rehabilitation services. Provide rehabilitation services for those seafarers diagnosed as having or who have acknowledged a drug or alcohol abuse problem. Non-discrimination. Develop and introduce legislation that ensure rehabilitated seafarers, following an individual's successful completion of an approved treatment program, are not discriminated against by employers. Declaring drug and alcohol abuse to be a medical condition. Encourage those with drug and alcohol abuse problems to seek assistance, thereby reducing health and safety risks to fellow seafarers on board ships.